Novel coronavirus or COVID-19 has been one of the most discussed health topics nowadays because it has affected many people from all walks of life across the globe. And today, we will answer some of the frequently asked questions online. So, stay tuned. Before anything else, let us define first what are FAQs. An FAQ is a list of frequently asked questions and answers on a particular topic. Now that you know what are FAQs, let us now define what is a coronavirus. Coronaviruses are a large family of viruses which may cause illnesses in animals or humans. In humans, several coronaviruses are known to cause respiratory infections, ranging from the common cold to more severe diseases, such as Middle East Respiratory Syndrome, or known as MERS, and Severe Acute Respiratory Syndrome, or also known as SARS. The most recently discovered coronavirus causes coronavirus disease, or COVID-19. Another question is, how long does the virus survive on surfaces? Studies have shown that COVID-19 virus can survive for up to 72 hours or 3 days on plastic and stainless steel, less than 4 hours on copper, and less than 24 hours on cardboard. The most important thing to know about coronavirus on surfaces is that they can easily be cleaned with common household disinfectants that will kill the virus. As always, clean your hands with an alcohol-based hand rub or wash them with soap and water. Avoid touching your eyes, mouth, or nose. Don't forget about that. Another important question is, are antibiotics effective in preventing or treating COVID-19? The answer is no. First of all, antibiotics do not work against viruses. They only work on bacterial infections. Although, in hospitals, physicians will sometimes use antibiotics to prevent or treat secondary bacterial infections, which can be a complication of COVID-19 in severely ill patients. They should only be used as directed by a physician to treat a bacterial infection. Can children or adolescents catch COVID-19? Research indicates that children and adolescents are just as likely to become infected as any other age group and can spread the disease. Evidence to date suggests that children and young adults are less likely to get severe diseases. But severe cases can still happen in these age groups. That is why it is very important that we should take care of ourselves and other people. Another question is, how long does it take after exposure to COVID-19 to develop symptoms? The time between exposure to COVID-19 and the moment when symptoms start, or the incubation period, is commonly around 5 to 6 days, but can range from 1 to 14 days. That is why a lot of people were asked to undergo 14 days quarantine or isolation. The last question is intended for the pet lovers. Several dogs and cats, domestic cats, and a tiger in contact with infected humans have tested positive for COVID-19. In addition, ferrets appear to be susceptible to the infection. In experimental conditions, both cats and ferrets were able to transmit infection to other animals of the same species, but there is no evidence that these animals can transmit the disease to humans and play a role in spreading COVID-19. Novel coronavirus is mainly spread through droplets produced when an infected person coughs, sneezes, or speaks. What about you? Do you have any questions? Please write them down below to keep the comment section alive. If you have more questions, you may also visit World Health Organization website at who.int for more information. Thanks for watching. Goodbye.